Okay, so let's look at symptoms of hypothyroidism on the left here. So when we're thinking of this, we're thinking of low circulating thyroid hormone that's not binding to target receptors, and the and thyroid hormone has many target receptors around the body, and because of that, hypothyroidism is going to lead to many signs and symptoms. Okay. So let's start on the at the top there, loss of brow hair. Well, basically loss of hair in general. So hypothyroidism, people can present with thinning hair or loss of hair. They notice that their hair is coming out much more easily. Enlarged thyroid gland, that's called a goiter. Why is that happening? Because the TSH is stimulating it so much that it's enlarging the thyroid gland, even though it can't make enough thyroid hormone. The pituitary gland is making tremendous amounts of TSH. Slow heartbeat. Okay, remember what the thyroid gland does. It reduces metabolism. It slows you down, right? So it causes bradycardia. Decreased appetite. It's slowing down the bowel. It's going to lead to poor appetite, constipation. Okay. Infertility and heavy periods. Okay. Thyroid hormone is very important for fertility, and making sure that the fertilized egg implants properly in the uterus, and also it is partly responsible for regular cycles. So typically we think of estrogen and progesterone, but lack of thyroid hormone will lead to irregular and heavy menstruation and infertility. Okay, carpal tunnel syndrome, which is numbness and tingling to the first three digits, and also hand weakness. Okay, why is that happening? Well, because of low metabolism, you get tissue that's accumulating in the body. And one of the sites that doesn't have a lot of room for extra tissue is the wrist, where the nerves go through, right? So it compresses, so the extra tissue compresses the nerves, and you get tingling and weakness to the hand, okay? At the bottom there, weight gain, okay? Reduced metabolism, increased tissue to the body. Mental dullness or poor memory, we mentioned that one. Intolerance to cold, yep, you're wearing 3 jackets on a warm day because you're intolerant to the temperature, okay? The feeling of tiredness because you have reduced overall metabolism. Cool extremities and swelling of the limbs. Well, the swelling of the limbs is that myxedema I mentioned. So it's just excessive tissue that's accumulating because of reduced metabolism, right? The constipation we covered. Very dry, scaly skin is common in hypothyroidism. So people come in with hair loss, very dry, scaly skin as well. Edema of the face, so a puffy face can happen with hypothyroidism. Okay, so I really just think of everything as just slowing down. The heart, the gastrointestinal system, the menstrual system. The skin is dry and coarse. You have edema to the legs. You have edema to the face. Okay, let's go to the other side. Hyperthyroidism. Most common cause? Well, I didn't mention the most common cause of hypothyroidism. Sorry. Hashimoto's thyroiditis. Hyperthyroidism, what's the most common cause? Graves' disease. Both are autoimmune diseases. Graves' disease is stimulating. It's antibodies that are stimulating the TSH receptors on the gland. What's going to happen? Well, I could get a swollen gland here as well because there's so much stimulation of the thyroid gland. And I'm going to get excessive levels of T4 and T3 in my bloodstream. What's that going to cause? A low TSH secretion by the pituitary gland. Okay, so what are some symptoms? Well, we can get what's called proptosis, which is another term for bulging eyes. And that's because in Graves' disease, you accumulate tissue behind the eyeballs. And as you accumulate more tissue, it pushes the eyes forward out of the socket. And they have that appearance of bulging eyes, okay? Abnormal heart rhythms. Well, remember, hyperthyroidism is you're activating the whole body. You have increased metabolism. So that's going to also affect the heart. Thyroid hormone can cause the heart to beat faster. It can stimulate the heart so much that you can get atrial fibrillation. So we often check a thyroid hormone or a TSH in someone with atrial fibrillation. Increased appetite for sure because of all the metabolism that's occurring. Unexplained weight loss, absolutely, because of all the metabolism that's occurring, right? Loss of libido and amenorrhea. So excessive thyroid hormone turns off the ovaries. Okay, it shuts down the ovaries. You get amenorrhea. You lose your periods. So this would be another reason for getting a TSH. Someone that comes in and says, I've lost my periods when they were really regular before. Okay. What else can occur from excessive thyroid hormone in the bloodstream? Well, irritability, hyperactivity, right? Increased metabolism everywhere. High blood sugars because of release from the liver. Intolerance to heat. You're so hypermetabolic that you don't need jackets on. The thyroid hormone is creating enough heat through all its metabolism. Okay. Tremulous hands. You're shaky from all the circulating thyroid hormone. You can have gastrointestinal symptoms. They wouldn't be the most common in hyperthyroidism. So nausea, vomiting, and diarrhea. That can happen because of overstimulation of the gastrointestinal tract for sure. Enlarged liver, again, not a common symptom of hyperthyroidism. Increased perspiration, so they're sweaty, they're tremulous, they're losing weight, they have atrial fibrillation. Everything is this hypermetabolic state, okay? And they can have very fine brittle hair and hair loss. I typically think more of hypothyroidism when I'm thinking of hair loss because it's more common in hypothyroidism. Okay? Okay, so we had a slide on hypothyroidism where we discussed it in a bit more detail. Let's do that with hyperthyroidism. And in brackets, the most common cause, Graves' disease. Now, someone could become hyperthyroidism if they're taking too much thyroid hormone. So say someone had hypothyroidism and they were given thyroid hormone as a replacement and they took too much of it, over time they would become and they would develop hyperthyroidism. But in general, that doesn't typically happen since patients are monitored in terms of the dose that they're taking, and also we do blood tests to monitor thyroid function, right? So by far the most common cause is Graves' disease. This autoimmune stimulation of the TSH receptors on the thyroid gland, leading to overstimulation of the thyroid gland and excessive amounts of T4 in the bloodstream, right? And because there are so many tissues that have thyroxine receptors, so thyroid hormone receptors, it really causes a lot of symptoms in the body. Okay? Now, what's thyrotoxic crisis or thyroid storm? That's just when the levels are so elevated that it's leading to severe hyperthyroidism symptoms. So patients can come in very tachycardic. They can have all kinds of severe arrhythmias. They can be hypertensive. They can be sweating. And we call that a thyroid storm. Okay. What lab values do we expect to find in hyperthyroidism? Well, elevated levels of thyroxine, T4, and suppression of TSH from the pituitary gland, so low levels of serum TSH. Okay? Okay, so again, I know I'm being a bit repetitious here, so you can skip the slide if you find you understand the information. But I added these slides just to reinforce the different glands. Okay, so Graves' disease, well, you happen to have autoantibodies that stimulate the TSH receptors on the thyroid hormone. Okay, so there's receptors on the thyroid hormone that are waiting for TSH to come from the pituitary gland normally. Well, these autoantibodies are just randomly stimulating those TSH receptors, leading to excessive amounts of thyroid hormone in the bloodstream. Okay, that's the most common cause of hyperthyroidism, called Graves' disease. The gland enlargement, that's the goiter we spoke about because of all this stimulation, right? That's all that means. And there's continual excessive synthesis of thyroid hormones that we're going to see in the bloodstream. So what does the bloodstream look like in terms of testing that we can do at the lab? High levels of T4, high levels of T3, and very low levels of TSH. Okay, I know we did this on an above slide. This is pure repetition for your benefit. Graves' disease, so excessive stimulation of the thyroid gland. Again, the most common cause of hyperthyroidism. It's going to turn on the body. It's going to increase the body's metabolism, right? It's turning up the functioning of the factory of the body. So nervousness, insomnia, so difficulty sleeping, really a real sensitivity to heat. You can peel off your jackets when everybody else has their jacket on because you feel so hot. Weight loss. There's that goiter, right? Enlarged thyroid gland. Atrial fibrillation, that irregular, fast heart rate. Or just an increased heart rate because of the overstimulation of the heart by the thyroid gland, thyroid hormone. So it's really like ramping up the sympathetic nervous system. And in fact, the thyroid gland makes the sympathetic nervous system have more of an effect on the body, right? It increases the sensitivity of the sympathetic nervous system. So that's why we're seeing a lot of these symptoms. And finally, the bulging eyes, which is due to extra tissue behind the eyeballs that's moving the eyes outwards, and they get proptosis, right? And that's classic for Graves' disease, where they have exophthalmos, or another term is proptosis, okay, of the eyes. Okay, so when I think of hyperthyroidism, I definitely think the number one cause is Graves' disease. Okay, so high levels of thyroxine in the bloodstream, low TSH. Okay, let's look at some other causes that might cause elevated thyroxine in the blood. Well, what if you just have um, thyroiditis? So inflammation of the thyroid gland, say from a virus. Okay, well, at the beginning of thyroiditis, and typically it's from a virus, by the way, the thyroid gland is is being broken down a bit, and the cells are releasing excessive thyroid hormone. So they can get hyperthyroidism at the beginning because the cells are breaking down and releasing thyroxine. And then as the cells run out of thyroxine but are still continued to be or still continue to be destroyed, they can get hypothyroidism. So thyroiditis from a virus can have a hyperthyroid phase and then a hypothyroid phase, and then usually it heals and goes back to normal. Okay? That's not a common condition, but just to tell you how it works. A thyroid adenoma is a non-malignant tumor in your thyroid gland. And what happens there? Well, so a little portion of your thyroid gland decides to make excessive thyroid hormone and secrete it into the bloodstream. Okay? So when we do a blood test, we'll have high thyroxine levels and a low TSH. Okay? And when we do an ultrasound, we may see a thyroid adenoma instead of Graves' disease. The next one, not common at all, excessive TSH production from the pituitary gland. So that would be called secondary hyperthyroidism, right? Because excessive TSH will lead to excessive thyroxine hormone levels in the bloodstream. The next one we'll skip. That one's really just, it's a repetition of the first one, so we don't need to do it. You can have nodules, so multiple nodules in your thyroid gland, and each one of those nodules are producing excessive amounts of thyroxine. So I would think of that really as the same as a thyroid adenoma. It's the same idea. They're just making more thyroid hormone. Excessive iodine ingestion, now we're getting into pretty rare conditions. I wouldn't worry about that. But if you were ever asked on an NCLEX or on an ATI, what would happen if you consumed excessive amounts of iodine? Well, it's going to be related to the thyroid gland, okay? And the last one, again, not very common, but women that are pregnant can get hyperthyroidism. And they can get that because the pregnancy hormone called beta-HCG is similar to TSH in structure. So it can actually stimulate the thyroid gland and cause higher levels of thyroxine in the bloodstream. Okay, so these are other conditions. I mean, it's kind of interesting, all these other conditions that can cause hyperthyroidism. Again, keep Graves' disease as number one. Okay, so here's a nice list of symptoms caused by excessive thyroxine in your bloodstream, excessive T4, say in the setting of Graves' disease. So if it's Graves' disease, sure, you'd have proptosis, the bulging eyes as well, okay? But that's only in Graves' disease that you have the bulging eyes, okay? But since it's the most common cause of hyperthyroidism, we'll include that. So if I think of hyperthyroidism, I think of this hypermetabolic state in the body by just too much stimulation of all these tissues in my body. So excessive sweating, heat intolerance, right? So someone comes in and they just say, I can't take the heat. I know it's not hot outside, but I just can't take the heat. It's just too much for me, okay? Increased bowel movements because of stimulation of the bowel. Tremors, right? Fine tremors are developing. Nervousness and agitation from stimulation of the brain. Tachycardia. Weight loss because of So much metabolism happening. But you can have fatigue. That's much more common in hypothyroidism. But you can imagine that your body is in this hypermetabolic state all the time, and it can lead to symptoms of fatigue. But if there was hypothyroidism and hyperthyroidism on a question, and there was fatigue as a choice, I would think of hypothyroidism. Decreased concentration, again, because you're agitated, you're nervous, so it's difficult to concentrate. And amenorrhea, loss of menstrual cycles, or very irregular menstrual cycles can occur. Okay, I don't need to go through this slide. We've done it. Just another slide um, on symptoms of Graves' disease, right, which is hyperthyroidism. But in particular, Graves' disease also has that what's called proptosis or exophthalmos, the bulging eyes. Okay, and just go around. We've covered most of these already. On the right is Rodney Dangerfield, and that is a good example of proptosis, right? So the eyeballs are actually being pushed a bit forward because there's soft tissue forming behind them in Graves' disease. Okay, so let's go through briefly the diagnosis of hyperthyroidism. What can we expect to see on the blood tests? Okay, well, primary hyperthyroidism is something is wrong with the thyroid gland where it's producing too much thyroxine hormone. That's typically Graves' disease. Rarely, it could be an adenoma in the thyroid gland that's producing excessive thyroid gland and those other conditions that we went over. But by far the most common, Graves' disease. Okay, so excessively high levels of T3 and T4 in the bloodstream. Okay, that's going to feed back to the pituitary gland and lower the TSH. That makes sense. So that's primary hyperthyroidism. Secondary hyperthyroidism, well, that's a cause that's occurring because the pituitary gland is making too much TSH from, say, a pituitary adenoma. Okay, so it wasn't the problem with the thyroid gland to begin with. So high TSH levels from the pituitary gland will then lead to elevated T4 and T3 levels in the bloodstream. And we would call that secondary hyperthyroidism, far less common. Okay. The antibodies for Graves' disease, there they are, in particular the thyroid stimulating immune globulin. You don't need to remember these terms, just the concept that there's autoantibodies that are actually directly attaching to the thyroid hormone TSH receptors and stimulating the thyroid hormone to make excessive T3 and T4. We can look at the thyroid gland with an ultrasound to make sure that there's nothing else in the thyroid gland other than Graves' disease that's causing excessive secretion of T3 and T4, such as a thyroid adenoma. Okay. There's also some radioactive iodine tests that we can do where we inject iodine that's radioactive. I mean, it's still relatively safe, but yes, it has some radioactivity, so we can pick it up as it goes into the thyroid gland, and we can watch how we can image the thyroid gland after we've injected radioactive iodine and see how the iodine is taken up into the thyroid gland. And if it's Graves' disease, well, the whole thyroid gland is going to take up the radioactive iodine. If it's an adenoma, so one part of the thyroid gland is overactive, Well, the radioactive iodine is going to concentrate in that one part of the overactive thyroid gland, which typically is an adenoma of the thyroid gland. Okay, so just a bit more detail there. Okay, so thyrotoxic crisis or thyroid storm, I just think of that as the severe spectrum of hyperthyroidism, right? There's an incredible amount of thyroid hormones that's circulating in the bloodstream, leading to excessive metabolism of the entire body. So that's going to lead to high fevers because there's so much metabolism happening, tachycardia, agitation, and finally, the anxiety and agitation gets to such a high level, psychosis can develop. Okay. So this is an emergency because we need to get that thyroid hormone down in the bloodstream in order to control these symptoms. Okay. So, for example, anyone who has hyperthyroidism, such as Graves' disease, and they undergo some kind of surgery or trauma, they can have a thyroid storm. Okay. And with a thyroid storm, we have to use medications to shut off the thyroid gland. And we often will use beta blockers to block all the excessive activity of the sympathetic nervous system that's also being affected by the excessive thyroid hormone. Okay, so just briefly here, since we're in pathophysiology, but just to get a bit of understanding how pharmacology and pathophysiology are combined. Propylthiouracil is a medication that we use for hyperthyroidism, right? It inhibits thyroid hormone production. So I'm sure you've likely seen this in pharmacology. Don't worry about it too much for this class, but just so you know that propylthiouracil and another one called methimazole are used in hyperthyroidism to reduce the level of thyroid hormone in the bloodstream. Okay. We can also inject radioactive iodine that destroys part of the thyroid gland. Okay. So it purposely destroys the thyroid gland to try and reduce the amount of thyroxine in the bloodstream as well. Okay. And sometimes what happens with radioactive iodine treatment is the thyroid gland was excessively sensitive to it, and it destroyed more of the thyroid gland than was expected, and now the patient has hypothyroidism, which is relatively easy to treat with just replacement of the thyroid hormone called levothyroxine, right? And lastly, the entire thyroid gland can be removed in hyperthyroidism, right? So instead of using drugs such as PTU and methimazole or radioactive iodine, just the gland can be removed completely, trying to leave the parathyroid glands still in place, since they're on the back side of the thyroid gland, sorry. So after the thyroid gland's been removed, then the patient will go on to thyroid hormone for the rest of their life. Okay.